Hello everyone. So in this video, we will now start looking at the prevalence of antimicrobial resistance in India. As we have already said that India has become notoriously popular for the incidence rates of antimicrobial resistance based infections. There are several studies which have been carried out by researchers in India and also by Indian Council of Medical Research, which is called as ICMR, to understand what is the prevalence rate of resistance in infectious bacteria in the country. So right now, the table that you see on the screen speaks about 4 pathogenic strains. Acinetobacter baumannii is a bacteria which is responsible for causing hospital-acquired infections. It is normally the notorious one which leads to blood-based infections, urinary tract infections, or even wound infections. When a patient is hospitalized, they may acquire this infection from the hospital. Escherichia coli is a strain which is responsible for causing certain GI-based infections, especially if it is the pathogenic strain that is prevalent in a human being. Klebsiella pneumoniae is responsible for causing respiratory tract infections. Pseudomonas aeruginosa again is responsible for causing wound-based, burn-based infections, or even in some cases respiratory tract infections. You can see that against these pathogens, certain drugs were very popularly used because they had effectivity against these pathogens. So ciprofloxacin, ceftriaxone or ceftazidime, or meropenem, imipenem, piperacillin, colistin, these were all popularly used antibiotics, and you can see that the rate of resistance that they are exhibiting against these antibiotics, especially if you look at ciprofloxacin, ceftriaxone and meropenem, you will see that the resistance rates are so high. Eventually with piperacillin and colistin also the resistant rate is increasing. Colistin especially is used when there is chronic cases of infection, and you can see that even with colistin the resistance rate is on rise. And if we run out of all these antibiotics for treatment, indeed we will find it very difficult to save the life of the patient. You can also see this graph wherein study has been done on these 4 bacteria again with respect to meropenem and imipenem antibiotics, and you can see the resistance rates that has been shown in percentages with these organisms. You can see Acinetobacter being resistant to these antibiotics with almost 70%, Pseudo showing resistance around 47%, Klebsiella showing resistance around 56%, and E. coli showing up to 16%. This indeed is a scary scenario because we are running out of antibiotics. And these are organisms which were isolated from blood culture, which means blood-based infection. And in such cases, if resistance is seen, how will we even try and save the patients? This is again a statistical scenario wherein you can see on the upper half, it is about Staphylococcus aureus, which is a gram-positive organism, and Enterococcus, which is a gram-positive organism yet again. It is erroneously shown there as gram-negative, but both of them are gram-positive organisms. So here also you can see that the resistance rates with all listed antibiotics over there, if you see ampicillin, cefoxitin, linezolid or vancomycin, the resistance rates are on constant rise. You can also see that the table given below has listed 3 organisms which are popular GI tract infection, that is gastrointestinal tract based infection organisms: Salmonella typhi, Shigella and Vibrio cholerae. And you can see that they are also exhibiting resistance towards the known antibiotics, and this is indeed a very, very scary scenario because these are completely treatable infections and we are now losing out on antibiotics. This graph is a disturbing one because it shows us that when Klebsiella pneumoniae, which is resistant to colistin or carbapenem, is causing an infection, and that to bloodstream based infection, around 69% of patients lost their lives because we did not have alternatives to treat these patients effectively. Only around 31% of patients could survive the infection, which was caused by such a resistant bacterial strain. That is indeed scary and also raises questions on how are we going to deal with antimicrobial resistance in the future, wherein probably once upon a time treatable infections will be very, very challenging to deal with. In the next video, we will start discussing about what is the prevalence of antimicrobial resistance in farming. That could be poultry farming, aquaculture, dairy farming. We will have a look at that and understand the Indian scenario of the same. So stay tuned.